On other video clips, we've talked quite a bit about using wrist motions to deal with tendinopathy and medial elbow pain and tendinopathy and lateral elbow pain. Now we want to look at isotonic strength building for the wrist itself when there's some measure of carpal instability. Carpal instability is going to most commonly be found around the lunate bone. So tearing of the ligament between the lunate and the capitate, or between the lunate and the triangular, or between the lunate and the scaphoid. These are the common patterns of instability at the human wrist. Oftentimes, those happen, those ligamentous tears, because the wrist is hyperextended. So the last thing we need to do is any exercise training that moves our patient with an unstable wrist into a position of extension. So two very simple isotonic exercises, but the big point that you know is that generally when we move the wrist into flexion and slight ulnar deviation, this is usually an acceptable motion for strength building when there's an unstable wrist articulation or articulations. Similarly, if you choose to strengthen in the direction of extension in an unstable wrist, it's important that that wrist never moves into extension. At most, you want to move toward extension, stopping a little short of a neutral position. If your end position is in slight flexion and slight ulnar deviation, approximately right here, that's a much more stable position for the wrist. And you're much more likely not going to irritate a patient who has some form of carpal instability.